Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope. I'm also someone living with my own chronic pain for over 30 years and working with people professionally who are living with chronic pain for the past 29 years. Today I want to talk about the big controversy about prescription medication. I've been blogging about this recently, about the war on pain management. I just want to talk about the solution right now. Part of the solution is the system I've developed called the Addiction-Free Pain Management System, which is very misunderstood. Some people don't like the name because putting the word addiction with pain management, they say, stigmatizes them. And it's addiction-free, for one thing, and it's not medication-free. I believe that there's three core components people need to be living successfully with chronic pain. One is finding the lowest, safest, and most effective medication protocols possible with the fewest side effects. Then, people need to find non-medical, non-medication-based interventions, things like hydrotherapy, physical therapy, exercise, acupuncture, etc., biofeedback. There's literally hundreds of these. And then the third core component is to deal with the very real psychological, emotional components of pain. When people experience pain in the body, say in the lower back like me, that pain signal goes up to the brain, into the thalamus, and it gets registered. When the signal gets to the thalamus sends a signal to our frontal lobes, and we have a cognitive or thinking response. From there, a signal gets sent to the primitive brain, the amygdala, the limbic system, and we have an emotional response. It happens like that. And it's not something people consciously do. Now, what does happen, though, some people, when they get that signal, it gets interpreted as, instead of, ouch, this hurts, as, man, this is horrible, awful, terrible, I can't stand this, it's killing me. Anytime people find themselves using words like that, they're into suffering. And I believe that freedom from suffering is everyone's right, but it's also their responsibility. And medication is not the correct protocol for the psychological and emotional symptoms. That's when people get in trouble. I've met with several people this week who I'm doing a screening with for one of the pain clinics in my area, because we want to make sure that they're safe, and number two, we need to make sure that the Drug Enforcement Agency doesn't target these pain providers or these pain patients, as is happening in other parts of the country. There's a lot of new legislation being passed around the country, Ohio and Kentucky for two. Florida has gone through their extremes this past year also. A lot of pain patients are being kicked to the curb, so to speak. They're sent out in the cold without any medication. We want to make sure that people have appropriate interventions to help them. Please join me on my quest to add some balance and fairness to this ill-advised war on pain management. Thank you.